The broadcast is now starting. All attendees are in listen-only mode.
Good morning, everyone. Welcome. Before we get started, we want to make sure that the audio is working okay. So if you can hear me talking and you can raise your hand, that helps me know that our audio is working. Awesome. Thank you. And you can go ahead and lower your hand because we'll use that function to solicit stakeholder feedback. All right. Welcome and thank you for attending the State Board of Pharmacy, Colorado Dental Board, Colorado Podiatry Board, State Board of Nursing, Colorado Medical Board, State Board of Veterinary Medicine, and State Optometry Board's joint stakeholder meeting via webinar today. Today is October 15th, 2021, and the time is 11:31 a.m. Before we get started, we would like to introduce the staff members from the Division of Professions and Occupations that are present. My name is Darcy Magnuson, and I'm a regulatory analyst with the division. Also attending is Dimitri Kunin, Senior Program Director, Karen Phelan, Program Director, Paula Martinez, Program Director, Roberta Hills, Program Director, and Yukon Morford, Program Director, as well as Elena Kemp, Regulatory Coordinator. We will be facilitating this stakeholder meeting. Due to concerns regarding COVID-19, the division has transitioned to a platform that is 100% virtual, and we appreciate your flexibility. As many of you have been to DORA stakeholder meetings before, we would like to reiterate the importance of your comments today. DORA makes decisions every day that may affect your life and your business, so your input is vital in the rulemaking process. Throughout this process, our goal is to create regulations that clarify and explain legislation, ensure minimum competency to enter and continue to practice, and provide only what is absolutely necessary for consumer protection without creating unnecessary barriers to the marketplace. The purpose of this joint stakeholder meeting is to identify a list of prescription drugs and substances using evidence-based practices, in addition to controlled substances that have a substantial potential abuse and must require pharmacists and prescription drug outlets to report those prescription drugs and substances to the Prescription Drug Monitoring Program, the PDMP, when dispensed to a patient. Your input will be part of the information that goes to the State Board of Pharmacy as it considers whether to adopt new rules that will include additional prescription drugs or substances to be monitored by the PDMP as allowed pursuant to Section 12-280-404, subsection 2B1 of the Colorado Revised Statutes and Colorado Senate Bill 21098. This meeting is being recorded and will be posted on each board's website by the close of business on Monday. As this stakeholder meeting is held solely by webinar, please raise your hand by using the hand icon if you would like to speak, and we will unmute your line so you will be heard by everyone. Or you can type your comment in the question section and we will read it aloud. Before we start taking comments, we ask that anyone providing comments please state your name and who you represent, if anyone. Feel free to provide either general comments on, well, we don't have draft rules. Feel free to provide general comments or specific comments. Please limit your comments to no more than 3 to 5 minutes and try not to repeat something that was already said. Stating you're in full agreement with someone else works just fine and will be noted. If you are using audio through your computer, please remember to put any phones on vibrate or turn them off. And whether you are using computer or phone audio, try to keep background noises to a minimum when speaking. So at this point in time, we ask that you provide the feedback to the boards. So you can raise your hand and we can unmute your line, or you can use the question function and we can read your comments out loud for other stakeholders. And Dimitri and Elena, if you see anyone, feel free to jump in. I don't see anyone yet, but we can work together. I'm calling people to provide comments.
Yeah, and while people are making the considerations, Darcy, this is Dimitri. I'll just say, kind of reiterate why we're here. So Senate Bill 2198 specifically had a section that allowed the Board of Pharmacy, or gave the Board of Pharmacy the authority to consider certain non-controlled drugs to be included as a requirement in the PDMP from dispensers in our state or other states to provide information to the PDMP. There are just a handful of states that do this. Not all do that have the authority to do so, but the handful that do just have a small handful of drugs that they may monitor. So the Board of Pharmacy essentially has asked for stakeholders to provide feedback on what drugs to consider, if any, to monitor in the PDMP outside of the current controlled substances that are monitored within the program. So specifically non-controlled drugs that there may be value, or the value would supersede or outweigh risk in having that data available to practitioners in the PDMP. And then the board will review the considerations or the stakeholder feedback at their upcoming meeting in November, and potentially, not necessarily, draft rules for consideration at a subsequent stakeholder meeting.
Thanks, Dimitri. We did receive a written question from Colleen Casper with the Colorado Nurses Association, saying in the current definition where it says, quote, report those prescription drugs, unquote, who are you envisioning that report would go to?
So I'm assuming you're referring to this I section that says that have a substantial potential for abuse and must require pharmacists and prescription drug outlets to report those prescription drugs and substances to the program when they are to dispense. So in terms of where that report goes, any controlled substances today that are dispensed in Colorado pharmacy drug outlets are reported or uploaded to the PDMP within the next business day. So in terms of where it's going, or the recipient, it's the PDMP as a database that's then used by pharmacists and practitioners throughout the state.
Okay, we received another question from David Clark. Are we only concerned about which drugs are reported on, or also how we will collect and report on these prescription drugs and substances?
So, to Mr. Clark, I mean, your questions will be provided back to the board as feedback in general if it's just a hypothetical question, but if it's not, the task at hand or what's being asked in terms of feedback is which drugs to consider, if any, that are non-controlled prescriptions. In terms of the how it's uploaded into the PDMP, those pieces are not within the scope of the stakeholder feedback request, as most of that has essentially been worked out in the last decade or so of pharmacies uploading into the program.
Okay. We have a hand raised by Michael McBride. I've unmuted you, so we should be able to hear you.
Would like the board to make sure that they remember that as veterinarians, we often don't work directly through pharmacies, and certainly not pharmacies within the state of Colorado, and to make sure that this program doesn't make that situation more complicated for us, because it's not uncommon for them to forget about us veterinarians in this.
Thank you, Dr. McBride. We have another written comment from Kayla Mathis. Kayla Mathis with the Colorado Nurse Association. Could you please give an example of a substance that has a substantial potential for abuse that is not already controlled?
Sure. And historically, I'm not sure how long you've been in the profession or not, there have been drugs, you know, the designation of something being a controlled drug or a Schedule 2, 3, 4, or 5, or even a Schedule 1 by the DEA does change over time. New substances and drugs develop and change or come into the marketplace a lot. And their designations in terms of their abuse potential or diversion potential, in this circumstance, abuse more specifically, changes as more is learned about the drugs over time. Additionally, other drugs, older drugs, sometimes gain patterns of abuse as well. Maybe not mechanistically from how the drug works, but just culturally. So it depends. There's certain drugs already in the last decade or two that have changed their designations. Vicodin has changed its designation once to something stronger. Tramadol has changed its designation once to something stronger, where tramadol was not controlled once but is now. And it depends by state too. States can be more strict than the federal guidelines in terms of how they view certain drugs. Other states that have done this, one example that comes to mind is a drug like gabapentin that has shown in some ways to have abuse potential. And even though it's a non-controlled drug, it has been tracked in PDMPs elsewhere in the country. So that's just one example, and that's one kind of value point because it has potential abuse properties that it's tracked. There's, I'm sure, other rationale or justifications that can be provided or sought after to track drugs in the PDMP, but that's usually a more common one.
Thank you. Lori Walmsley, I show your hand is raised. I've unmuted you and you're self-muted. Lori Walmsley. I should be able to hear you if you unmute on your end.
Yes, I'm here. Sorry about that. I couldn't find the controls. Lori Walmsley on behalf of Walgreens. One thing for the board to consider when talking about adding potentially non-controlled substances that we've seen in other states is, since there isn't a requirement for a prescriber to have a DEA number for a non-controlled substance, there tends to be more rejections in states that have that can result in delayed reporting into the PDMP and more manual corrections that need to be done. Based on the fact that that is still a required field. It's not a situational field, even for the non-controlled drugs. So the veterinarian that spoke up earlier that may not need a DEA number to prescribe some of these other types of drugs, there could be some downstream effects with reporting and also workload for both the PDMP staff and pharmacies with reporting on their end for corrections.
Thank you. I'm going to go ahead and lower your hand. If you want to provide any additional comments, feel free to raise your hand again.
This is Elena. It looks like we have a hand raised by Miss Emily Ha. I'm going to unmute your line.
Hey there, this is Emily Howe with Amazon Pharmacy. I just want to go ahead and echo what Lori Walmsley had said about not requiring a DEA number to be reported for a non-controlled drug like gabapentin. We have seen that issue in other states where it causes a lot of errors, and then rules need to be further amended to remove that requirement.
Thank you. All right, we have another hand raised by Eva Barrows Tube. I'm going to unmute your line. It looks like you're self-muted. All right, your hand was lowered. If you do want to provide comments, just raise your hand again and we'll unmute you. We have another hand raised by Miss Nadia Haddad. I'm going to unmute your line. All right, it looks like you're also self-muted. All right, we got a comment from Miss Nadia Haddad, just asking how to unmute. If you look at the microphone icon to the far left, if you click on that, you should be able to speak and we should be able to hear you.
Okay.
Hello?
Can you hear me?
Yes.
Okay. I'm Nadia Haddad. I'm an addiction psychiatrist, and I regularly use the PDMP. I think what I'm trying to juggle, and I love more input from other parties here, is really the utility of adding additional monitoring. I mean, in some ways, I think, sure, that would be great if I could look at the PDMP and see, gabapentin or sometimes Seroquel is abused by patients. But I do think that the PDMP becomes less and less useful the more cluttered it becomes. And I do think that for the limited number of times that I'm trying to address whether gabapentin is being abused or Seroquel is being abused, usually a call to the pharmacy and trying to figure out that piece of it is sufficient. So I lean towards saying adding non-controlled substances to the PDMP has less utility than maybe confusion and clutter that it would be causing, and that if a drug is problematic enough to require being added to the PDMP, that it should probably be a controlled substance.
Thank you. And
We
like
received a comment, go ahead, from Kayla Mathis, who said agreed. And Jody Carter-Jones, who also said agreed. We have another hand raised from Kristen Steer. Kristen Steer, we should be able to hear you.
Good morning, everyone. I'm a clinical pharmacist with 8 years of practice in hospice, pain, and palliative care. So working around a lot of substances that are controlled and not controlled, and psychoactive. I guess I do agree with some of the more recent comments about how the PDMP could become potentially more cluttered. But on the other hand, I guess to play devil's advocate, and maybe this is an unpopular view, suggesting possibly that the PDMP maybe eventually be used as a platform to report a more centralized location for all medications, prescription medications, controlled and uncontrolled.
Thank you. I'm going to go ahead and place you back on mute and lower your hand. while we give folks a little bit more time and see if anyone else wants to chime in, let me read one written comment before I start that. Jody Carter-Jones says, great idea for a state level EHR maybe. Or HIE. I do want to ask Dimitri if he can provide some more information about next steps after the meeting today with respect to the pharmacy board's consideration of the stakeholder feedback. Dimitri?
Sure, thanks, Darcy. So the board asked for this at their last meeting in September. This feedback from this stakeholder meeting will be brought back to them at their November meeting, which is scheduled for November 18th. They'll review the feedback and they'll discuss and make considerations. They may decide no further drugs need to be added into the PDMP, and there would be then no further follow-up necessary. The bill and its potential authority that it's given the board would be closed until such a time if they're interested in the future to evaluate again what drugs to include in the PDMP outside of controlled substances. If, however, they make a determination to go forward with a certain drug or drugs that are non-controlled to be tracked in the PDMP, they'll draft such rules to make that possible, as this bill gives them the authority to do so. Those draft rules then will go for stakeholder feedback, again, most likely at a time in December or sometime between their November and January meeting. And then they'll potentially review that at a rulemaking hearing if necessary on January 20th, which will be their next scheduled meeting after November. So there's a lot of hypotheticals there and possibilities, none of which are known for sure until the board has had an opportunity to make those considerations and discussions happen at their next meeting in November. Darcy, does that kind of cover it? I can go further in timeline if necessary, but I feel like there's too many unknowns at this point.
No, I think that's great. I just wanted people to know that this would be considered by the board at their next meeting in case any members of the public wanted to attend that as well. So before we take, I see a couple more hands raised, but I wanted to read the follow-up comments regarding Kristen Spear's comments. So Kristen Spear followed up and said, yes, that's sort of what I was thinking, central EHR concept. And then we received another question from Lucas Wangerin. Sorry if I mispronounced your name. How is gabapentin being abused? What are the risks or effects? How prevalent is this?
So the gabapentin piece, I'll leave it up to any others that want to chime in to answer that. Usually in stakeholder meetings, we don't provide any type of information like that. I'd say, honestly, I don't have it in front of me. But if any others have experience from the profession or want to contribute to that conversation for stakeholder feedback, you're more than welcome to.
Thanks, Dimitri. So Gina Moore, your hand is raised. So I have unmuted you. We should be able to hear you if you looks like you're good.
Okay, thank you so much. Hi, everyone. My name is Gina Moore. I am a pharmacist by profession. I'm an associate professor and legislative associate professor at the University of Colorado School of Pharmacy, and then also legislative chair from the Colorado Pharmacist Society. So I just wanted to give some perspective because at least with CPS and some of the stakeholder groups that we convene with pharmacy sunset and PDMP was addressed in that. Just, I think, to provide some perspective, and I think this is an important consideration. The thought is to try to, because our state doesn't have enough a functional ability to exchange information across, functional electronic record, as Kristen mentioned and others, adding all drugs is a way to try to address that in a way to improve medication safety. Now, granted, there's some concerns with that. I believe that at least there is one other state that has adopted this, and they were able to set up their interface in such a way that you're able to just look at controlled drugs and then have another tab to look at all drugs. So we're certainly supportive of anything that improves medication safety and the transparency of use of medications, recognizing there are that's a lot of data, but also if it can be as user-friendly as possible, we certainly would support that if it can be implemented in that way. I just wanted to address the gabapentin question because our school does work with the state Medicaid program on DUR, and that is something we continue to monitor is abuse of other controlled substances or non-controlled abuse of other substances such as gabapentin in different populations looking at abuse. So it's certainly well reported in other states, and we continue to look at it closely in our state. Thank you.
Thank you. I see Kristen Spear, your hand is raised again, so I have unmuted you. We should be able to hear you when you unmute. Kristen Spear.
I'm sorry, that's strange. I don't have my hand raised. I don't have any comments or questions.
That's happened before. No worries. I'll lower your hand and place you back on mute. Erica Pike, show your hand is raised. We should be able to hear you. Erica Pike.
Hi, thank you so much. Erica Pike here from the Colorado Academy of Family Physicians. I'm their policy director. I appreciate the other comments. The person before me mentioned implementation concerns around and examples of how to do it well if there are additional drugs added to the PDMP for tracking to make sure that the controlled substances float to the top or have the separate tab like they mentioned. So that's a comment our members have had. Another piece that we've been talking about in multiple spaces is the integration challenge for some practices who haven't been able to embed that PDMP into their electronic health record system and the clunkiness of it and some of the challenges there. So if it is going to be expanded to include other drugs, making sure there's either technical assistance and funding for providers to be compliant with the new regulations. Another piece that I want to make sure that gets brought up is patient safety. So if a patient has their full prescription history in the database or even additional prescriptions and they had a negative reaction, but it's in there and a provider sees that it's in there and they have a history and prescribes how to remedy those situations and to account for and really to ensure there isn't liability attached to something like that, like a previous bad history with a drug. So those are kind of the three areas that I wanted to make sure I mentioned. And then the final thing, and it's more of a question, I would like to check in with our members about additional medications if they think they would be valuable. I was hoping to gather some suggestions from today's call and bring back to them. And is there a hard deadline for feedback before a draft rule comes out?
We generally send all information to the board 2 weeks in advance of the board meeting. So the pharmacy board meeting, like Dimitri said, is scheduled for November 18th. That's the next pharmacy board meeting. So ideally, we would like to have any written comments before that date so that we can group them all together and send them to the board for review in advance of the board's meeting.
Thank you.
Okay, we received a couple of written comments. I will go through those. Colleen Casper with the Colorado Nurses Association have prescribers who rely on medications such as gabapentin and other scheduled drugs for routine specialty practice therapy, neurospecific diseases, functionality of the system if of highest priority. Jody Carter Jones said, diagnosis associated with pharm treatment are necessary for clinical interpretation of on all drugs. HIE is the best option, probably. and a follow-up to that. Tough to just look at a list of meds and make a determination. David Clark said, where do we send our written comments for the board regarding the PDMP? That's a good question. Please send all written comments to the email address that was provided on the notice for today's meeting, which is Dora_DPO_rulemaking@state.co.us. We will go ahead and drop that into the chat. I don't know how it appears on your screen, but chat or question function. So you have that as well. We will continue to monitor for a couple more minutes to see if anyone else wants to provide feedback. We did receive another comment from Kristen Spear. Another consideration is for those non-controlled substances that are also OTC, how might the reporting be managed? For example, loperamide is available OTC and can be abused at high doses for opioid-like effects. Excuse my mispronunciation, dextromethorphan is another example. Okay, so this is the last call for any stakeholder comments by webinar. Like we already said, you're welcome to submit written comments as well for the board's consideration at its November meeting. Just wait here until 12:05, and then I will go ahead and wrap up the meeting if we haven't received any other comments. We received a question from Lucas Wangerin, sorry. What evidence-based practices are being outlined? What is the criteria? And Demetrius, correct me if I'm wrong, but I think that determination and interpretation would be up to the board.
Yeah, exactly.
Okay. I don't see any other hands raised, and we haven't received any additional questions. So I am going to wrap up the meeting. Thank you again for your participation and discussion in today's meeting. All comments and recommendations will be provided to the State Board of Pharmacy for review and consideration. And that concludes the stakeholder meeting. Thank you for your participation. We are going to end the webinar now.